Menopause and perimenopause are life transitions that affect every woman differently, yet one symptom seems to be almost universal: unexpected aches and pains. These can appear in the joints, muscles, head, breasts, or even teeth, and what makes them so frustrating is that they often seem random. One day the pain is in your knees, the next in your shoulders, and sometimes it vanishes only to return when you least expect it. Many women find themselves asking, "Is this normal? Is something wrong with me?" The reality is that these discomforts are very common during this stage of life, and while they can be confusing, there are real explanations behind them, and practical steps you can take to ease the burden. Today, we'll explore the most frequent types of pain experienced in perimenopause and menopause, uncover why they happen, and share powerful strategies to help you regain comfort and control. First, let's talk about why pain seems to increase during menopause. Scientists don't have every answer yet, but one factor is crystal clear: declining estrogen. Estrogen isn't just a reproductive hormone. It plays a critical role in regulating pain perception, inflammation, and tissue health. When estrogen drops, the body often responds with more inflammation, and the nervous system becomes more sensitive. In other words, pain signals get amplified. A minor irritation that might not have bothered you in your 30s can feel sharp and persistent in your 50s. Imagine turning up the volume on discomfort. That's what happens when estrogen falls. This explains why many women suddenly find themselves struggling with joint stiffness, muscle soreness, or frequent headaches, even without an obvious cause. One of the most common issues women report is joint pain. For some, it starts subtly with stiff fingers in the morning. For others, it's sore knees or aching hips that seem to flare up after sitting too long. Many women visit the doctor only to be told that nothing serious is wrong, yet the pain is very real. The reason lies in the ligaments, those flexible bands of tissue that connect bones to each other. As estrogen levels decline, ligaments lose elasticity, which reduces joint mobility. When this happens, joints can rub against each other, creating inflammation and pain. Add dehydration to the mix, and stiffness becomes even worse, especially after waking up. To ease this, hydration is your first line of defense. Drinking water consistently during the day, and even a small glass before bed, can reduce morning stiffness. Supplements such as omega-3s from fish oil or flaxseed oil help lubricate joints, while gentle exercise, yoga, stretching, or light walking keeps them mobile. Even if you feel discomfort, staying active prevents joints from locking up and reduces long-term pain. Closely tied to joint discomfort is muscle pain, another hallmark of menopause. Many women describe waking up sore as if they had exercised intensely the day before, even when they haven't. This happens because tendons, the tissues that attach muscles to bones, also tighten during hormonal changes. The pulling and tension create widespread soreness in the arms, legs, shoulders, neck, and back. On top of this, magnesium deficiency often plays a role. Magnesium is essential for muscle relaxation and recovery, yet hormonal changes increase the body's demand for it. Without enough magnesium, muscles stay tense, cramps appear, and soreness lingers much longer than before. Have you noticed that workouts leave you sore for days, while a year ago recovery was quick? That's often a sign of low magnesium. Another condition to watch for is sarcopenia, the age-related loss of muscle mass, which accelerates during menopause. Left unchecked, it weakens your strength, balance, and mobility. The solution lies in nutrition and movement. Eat protein with every meal, hydrate well, add magnesium-rich foods or supplements, and engage in resistance exercises to preserve muscle mass. If you experience ongoing or worsening muscle pain, especially in your thighs and calves, consult your doctor to rule out serious muscle breakdown. Another area where pain often strikes is the breasts. While tenderness has long been associated with PMS, in perimenopause it often becomes more intense, prolonged, and uncomfortable. This discomfort is usually linked to fluctuating hormones combined with fluid retention. Breast tissue acts much like a sponge, soaking up and holding water when the body is dehydrated. The result: swollen, heavy, sore breasts that may even change in size temporarily. The simplest yet most effective fix is hydration. By drinking enough water daily, you can often reduce breast tenderness significantly. Some women also benefit from zinc supplements, which support tissue health. But here's a crucial point: any new, sudden, or unusual breast changes should always be evaluated by a doctor. While tenderness is often hormonal, It's essential to rule out other conditions early. Your health is worth the extra step. Headaches are another widespread complaint during menopause, and they can be especially disruptive. The tricky part is that they have many potential triggers. Dehydration is a big one, but headaches can also be set off by skipping meals, consuming too much caffeine, indulging in sugary snacks, or eating high-salt foods. Blood sugar fluctuations are another culprit, especially if you go too long without eating. Because triggers vary, one of the best tools you can use is a headache diary. By recording what you eat, drink, and do before a headache begins, you can identify patterns and eliminate the habits that make headaches more frequent. Sometimes the fix is as simple as carrying a water bottle, balancing meals with protein and fiber, or reducing caffeine. But if headaches are frequent, severe, or push you to rely on painkillers regularly, don't assume it's just menopause. See your doctor to rule out other causes, because while menopause can explain many symptoms, it doesn't explain them all. One type of pain that surprises many women is dental pain. Falling estrogen can affect oral health in ways few people talk about. As hormone levels drop, the gums can become drier and begin to recede, exposing more of the teeth to sensitivity and discomfort. You might notice bleeding gums, a dull ache behind the teeth, or even the unsettling sensation that your teeth are loose. This is not necessarily a sign of cavities, but rather the hormonal shifts affecting gum tissue. The first and most important step is to visit your dentist and explain that you are in perimenopause or menopause. This context helps them provide better treatment. To support your mouth at home, natural remedies such as sea buckthorn oil can help relieve dryness, while CoQ10 supplements may strengthen gums and reduce bleeding. Taking care of your oral health during menopause is not just about your teeth, it's about your overall quality of life. Now, let's not overlook one of the biggest amplifiers of pain during this stage: poor sleep. When you don't sleep well, your body doesn't just feel tired, it becomes more sensitive to pain. Studies show that lack of quality rest heightens pain perception, making even mild aches feel unbearable. This creates a vicious cycle. Pain interferes with sleep, and poor sleep makes pain worse. Breaking this cycle is essential. Creating a calming bedtime routine, limiting caffeine in the afternoon, and using relaxation practices such as meditation or deep breathing can make a noticeable difference. For some women, professional support may be needed to manage insomnia or sleep apnea. Prioritizing sleep is not a luxury. It's one of the most powerful tools you have to reduce pain and improve overall health during menopause. So, what's the bigger picture here? Aches and pains in menopause aren't random. They're the result of interconnected changes in hormones, inflammation, hydration, and even sleep. But here's the empowering truth: you are not powerless against them. Small daily choices, drinking water, eating protein and magnesium-rich foods, moving your body, supporting joint and gum health, and protecting your sleep, can dramatically change how you feel. These aren't quick fixes, but they build resilience, reduce discomfort, and help you feel more in control of your health. As we wrap up, remember this: menopause is a natural stage of life, not a disease. Yes, it brings challenges, but it also offers an opportunity to reconnect with your body and prioritize your well-being in ways you may have neglected before. Your body is asking for care, hydration, movement, nutrition, and rest. And when you give it what it needs, the rewards are powerful. Don't ignore your symptoms or push through the pain thinking it's normal. Listen to your body, take action, and when in doubt, seek professional guidance. Now, I want to hear from you. Have you experienced any of these types of pain during perimenopause or menopause? Which strategies have worked for you? Share your story in the comments, because your journey could be the encouragement another woman needs to take charge of her own health. Remember, you're not alone in this. Millions of women are walking this path, and together we can find relief, strength, and vitality through this new chapter of life.